All right. Hello, guys. My name is Amanda, and I am a PTA here in Greenwich, ONS. And we are going to be talking about how posture affects back and neck pain. I appreciate you joining me, and I hope you enjoy this presentation. Trying to get my slides to go here. Give me a second. Okay, so just giving me a second. I'm still having some technical difficulties here. Okay, so since I'm still having difficulties getting my slides to move, I'm just gonna keep talking and hopefully we can get it figured out. So, facts about the neck and back pain. 8 out of 10 people suffer from pain in some form during their lifetime. Pain doesn't necessarily mean there's damage or an injury, but it's letting you know that there's something going on. Pain usually ranges between a medium, a dull, an achy, kind of an annoying persistence, severe to debilitating spectrum that pain can radiate through the back. Usually when you start having pain anywhere in the neck or back along the spine, there starts to be restriction in the mobility, interference in the normal function and quality of life. The neck pain can usually also have issues with, because of where it's located in the head and your shoulders, it will cause more irritation with just unbalance, and it can actually be more injured because it's not as protected as your back is. So there's two forms of pain. There's acute pain, which means it happened immediately or suddenly, and it can last from a few days to a few weeks. And then there is chronic pain that can last for a couple months, weeks, and even years. It can also be continuous or intermittent. So what we can do to help is, kind of give you pain skills and management skills to kind of rebalance everything. So the spine is actually made up of 3 different sections, technically 4, but we usually focus on only 3, which is your neck, your thoracic, and your lumbar. And you want your spine to have what we call an S curve because it acts as a coil during impact that absorbs the shock through the discs in your vertebrae. This is going to help you maintain good balance, like if you jump off of something. When you land, it gives you that stability to keep moving. The muscles that support your neck and shoulders and your back also tend to stabilize the motions you have. So the 2 main muscle groups would be your flexors and your extensors. The flexors are in the front part of the body, and they're going to help stabilize your trunk when you're lifting things. The extensors are what's actually going to pull you back on the back part of your body, and that is what helps to stabilize your balance when you lift up. you need stability between the two, and that is what actually helps you to do your everyday activities. When you start having pain, it's usually because there is a instability or an asymmetry, excuse me, that happens between the muscles and the vertebrae, and that's what starts causing poor posture, aches, pains, and other issues. So, causes of pain. There's so many things that can cause pain, and it's not necessarily just how you sit, how you move, how you act. It can be from, dehydration. It can be if you're a smoker, you actually create more cortisol in your system and not enough oxygen, which your body needs the oxygen to get to all the tissues to help them stay fluid and mobile. And when you are a smoker or get very dehydrated, the tissues get very dry and tight, which can end up causing pain when you try to reach or do something. Other things that can cause pain is that poor muscle tone. So any weakness or overtension is considered poor muscle tone. Tension or spasming in the muscles, so like a Charlie horse, that is painful. And usually, again, that can be contributed from dehydration or if you did too much. Same with this sprain, strain, and overuse. A trauma or injury, so obviously if you fall or get in an accident or something like that, obviously that's going to hurt and your body's going to let you know, hey, there's something going on, you need to get it checked out. Inflammation and infection are usually a big sign that your body gives you with pain that there's something going on. So like I said before, pain isn't necessarily that there's an injury or a trauma. It's just letting you know that your body's knowing something's different going on. A big thing with posture and pain is some people have a lot of abdominal pain and digestive issues because of how they are sitting, how they are standing, how they are moving. If you slouch a lot, you're going to compress everything, which doesn't make it want to move as well. So that can cause a lot of pain. The last thing that most people don't think about is your emotions is also a big indicator of body pain. So if you're stressed, if you have depression, anxiety, anything like that, that's going to retain in the muscles up through here and in your neck. That can also go into your abdominals. It can go into your hips and your back. And, it depresses the system, which again can cause pain. So with posture, in therapy, we look at usually 4 different types of standing posture. To the very left, you have your balanced posture, which is your ears are over your shoulders, which are over your hips, and it keeps a straight line. That is showing good symmetry between the flexor muscles and the extensor muscles from your neck all the way down to your pelvis. That's our ultimate goal. And when we're moving, when we're sitting, when we're standing, even when we're sleeping, you want to keep that tall posture because that is what gives you the best optimum function for your entire body. The next thing we look at is called flat back. That is usually when you are missing one of the curves in the spine. And what that does is actually starts causing the springiness in your spinal cord not to move as well. And it compresses a little bit on that chest because you want to lean forward. When you start to hunch forward a little bit because you don't have one of the curves, it starts to tighten the muscles in the front and overstretch the muscles in the back. When that starts to happen, you also start to lean your head forward, which can put a lot of strain on the neck and the top of the shoulders, but then also put a lot of strain in your low back. The next one is sway back. You usually start to see this one more with older people because their abdominal core is not as strong as it used to be, and you start to kind of lean back into your pelvis and have the structure of your body kind of support you instead of your muscles trying to support your structure that's supporting you. And what happens is everything kind of just gets more exacerbated and even tighter. The head gets a little farther forward, and then that causes headaches, that causes back pain. Your balance starts to get bad. Your standing posture is difficult to stay in that position very long. And it can contribute to a lot of other problems. You know, probably the most famous character who has sway back is Shaggy from Scooby-Doo. He's a perfect example of what sway back looks like when people walk. Kyphosis or lordosis is usually the last standing posture we look at. And this is definitely something you see in people who work in an office a lot, definitely more in our elder population, that hunched back almost look, you know, the leaning over. Usually these people are suffering not just from, you know, the back pain, the neck pain, but also issues with breathing, lifting their arms because of that structure change. If you look at the rib cage, it's more compressed than any of the others. Just for that same reason is that weakness and constricting on your lungs. So now, something that can correlate with all of our adolescents, our teens, our college students, even us adults, spending time on our phone. If you look at the left again, you know, you see someone holding their phone, nice tall posture, and it still shows 0 degrees, right? Because it's balanced. However, you look underneath, it shows 10 to 12 pounds. That's how heavy your head is. So for every couple of degrees forward, your chin goes over your shoulders, you are compounding the weight that has to support your neck to your head. That means you're tightening your muscles hard, you're straining the upper back, you start contracting the short muscles in the front, and I don't know if you've noticed, I suffer from this too, your fingers start to fall asleep after about 20 minutes of playing on your phone. And as you get more tired, you start leaning forward more, which causes even more pain. So when you come out of it, you're like, oh, I ache, I hurt, I'm sore. Why? Well, because for every couple degrees forward you go, you add a lot more weight to your head for your neck and shoulders to have to compensate for. And that's a great picture to show teens, your kids, or anyone else you know that suffers from, you know, text neck. It's a great picture to kind of give that perspective of what's going on in your head and neck. So this diagram, again, shows kind of what's happening in the body when you start to compress and fall forward. For every degree that your head comes forward, the chest is going to also start to come forward, which is also going to change your posture. But what people don't realize is when you have a poor posture and a weak core, you're also starting to affect the internal organs as well. So, you know, for every inch or two you bring your head forward, you start to constrict your sinuses, you start to clench your teeth more, and you start to have more headaches and strain on the neck because of the position it has to try to hold yourself in. For more degrees, your chest comes forward. Your diaphragm gets constricted, which allows for less breathing capacity. You start putting pressure on your kidneys and adrenal glands, which help function in flushing your system. And you start putting pressure on your abdomen, which can change your eating habits. It can put pressure on your digestion. It can also cause issues with getting your colon and all the stuff out of your system because it's too compressed to move, you know, stability. It's hard to move more fluidly. So this is why it's so important that the better posture you can have for you, the better you're going to feel, the less pain you're going to have, and the more stable and comfortable you're going to be in the long run. So a lot of us, as we get tired, you know, for students when they're studying, for us when we're doing our office work, you know, we kind of start to hunch over. We just want to get the paperwork done. And we kind of forget that, you know, if we have poor posture as we're getting tired, that we're actually going to make ourselves ache and hurt more by the time we're actually done with work. than if we kind of keep that nice tall posture and lifting things up so that it's easier to move through. Same with when we're watching TV or sitting with friends or family. If you are slouching in your chair or hunched over watching something interesting, 20 minutes later, you try to get up and you're like, whoa, I'm hurting. Whoa, this is really stiff. What's going on? It's because your body has to strain harder to compensate that poor posture and work just twice as hard as if you were sitting up properly and supported in the chair you're on. Your body has to work so much harder to hold the poor position than it does when it has to hold a more upright position. The hard part is if you've been holding a poor position for a while, learning to get yourself in an upright position again, it's painful and it takes some time to get used to. But if you stick with it, that tall posture becomes much more comfortable and you'll want to stay in it much longer, and it's easier to function in, and it's an easier just way of getting everything done, but you don't ache so much either. So another picture of when we're kind of slouching a little bit, you can see how the pecs kind of get depressed, they tighten up, it makes your shoulders round more, but then it makes the upper muscles in your back stretch out and get weak, and then they can't pull your shoulders back anymore to stabilize to keep that tall posture. So towards the end of this presentation, I'll show you some exercises to kind of help balance that. The other picture here is showing what's become very popular in a lot of our offices now is the standing desks and your regular desks. And the biggest thing that you always want to look at is your ergonomic workspace. This is where we spend most of our lives, is in our office. For a majority of us, that means that we need to have our workspace as tailored to our needs as possible so that we can be as comfortable as we can, because then that means we're going to be more productive and more functional without having issues in the long run with back pain, headaches, abdominal pain, lumbar pain. It will help productivity so much more to have an ergonomic space. So this was the closest picture I could get that gives you most of what you need to have a good ergonomic workstation. You want your eye level to be equal with your screen or kind of slightly above. That way when you're looking down neutrally, it's a comfortable position that's not straining your neck either too high or too low. You want your keyboard to have your arms at that 90 degrees or slightly lower. That way when you're typing, you're not kind of giving yourself the carpal tunnel or tension issues, and it helps to be a little bit more efficient with your typing. You don't want your chair to be too low or too high. You want to keep it at that 90-degree angle, because then that's giving you the best support you need. Some people will also have a step stool under their desk they put their feet on, because then sometimes that will take some of the pressure off their low back, which makes it obviously more comfortable then to continue doing your work if you don't have time to be able to take multiple breaks during the day. When driving, I have a lot of people who come in for therapy because of back pain with all the driving that they do. But one thing that I've noticed many of them do is they don't sit all the way back in their seat when they drive. So it is really important when you are sitting and you're going to be driving, traffic's starting to get busy again, we're going to be sitting in traffic longer. You want your seat to be comfortable when you're driving. So you want to have your seat close enough to the driver's wheel. That way you are fully supported at your hips and your shoulders, but you don't want it too far back that you're not comfortable and have that little bit of space underneath the knee when you're pushing on the pedals. The other thing with this picture and the diagram is you want the headrest lifted high enough that when you rest your head back, it's comfortable to lean against. Because a lot of people suffer from neck pain when they're driving, especially when they're getting tired and they're frustrated, they want to get home. Instead of leaning back into their headrest, they lean forward and tense everything more. What I found with all the driving I've done over the years is when you lean back into your seat and stay resting comfortably in your chair when you're driving, you have less arm pain, the tension in your neck goes down, and the less back pain you have in the long run, because you have that full stability to, get through the rush hour to get home without so much pain by the time you actually get home. So when we have issues with back pain, hip pain, neck pain, how we lay in bed is a big deal. You want your bed to be firm yet comfortable enough for you. But if you're suffering from low back pain and hip pain, it's really essential that you have a pillow between the knees, because when you don't, a woman's hips kind of go like this. Well, the hips are here, the knees are here. When you put a pillow there, it kind of balances that out again. And when you do that, it instantly takes pressure off the hips. It works the same with men who have hip and back pain. The pelvis still goes this way, not quite as much, but you put that pillow in and it keeps it in the neutral position. That's going to relieve a lot of pain. It might not stay all night, that's okay. But when you put the pillow in when you go to sleep, most often you'll get through most of the night with the pillow between the knees and have a more restful sleep than without the pillow at all. The neck pillow, you don't want a pillow too thin that your head's tilted like this, or too thick that it's going the other way. You want it balanced enough that it's supporting in a neutral position. And when you're getting out of bed, you really want to just sit up in bed, because that puts a lot of strain on your lower back, your upper back, and on your hip flexors, which is on the front part of your hips. You want to roll to the side and put your legs off the bed, pushing yourself up. That way you're keeping that long trunk stable. We call that a log roll. You're keeping the whole system here straight and stable. When you're having pain or you're very stiff, it's a good way to be able to easily get out of bed without so much pain in the morning. So with issues to help deal with pain, when you're at home, you don't know if it's an acute issue. If you've had pain for a while, if it's a chronic issue, what's dealing with it. But a big thing that can definitely help is using the over-counter meds. It doesn't mean you're going to be a drug addict, but it does help with inflammation. So take when you had an injury or you're feeling over achy, it's going to help calm things down so you're not hurting so bad, because if you can get the inflammation under control fairly quickly, your pain will go down really quickly also. They kind of work hand in hand. If you try to just work through it, it's going to take longer to get the pain to go away. Hot and cold does really well with helping with pain as well. So if you're having a lot of pain, you're really achy, you don't necessarily want to start with meds, start with a hot pack. If it's really stiff area that's painful, and after a while, go to the cold pack, because the cold's going to help decrease the inflammation that either the hot pack and the injury or pain is causing. Exercise is huge to help with pain. It doesn't mean you have to do a strenuous program, just walking, going for a walk around the block, going for a walk for park. Just getting your body moving, even though you hurt, can actually help decrease pain and improve flexibility and the mobility in the tissues that are really tight. If things are still not feeling good, go see the doctor. See what he says. He'll probably prescribe PT. And then that's where I come in. So with PT, what we do is we kind of look at what's going on. Is it a chronic issue? Is it an acute issue? Is it a debilitating issue? Is there something that we can do to help? We'll assess to see if their physical therapy is an appropriate avenue for you. We always try to strive for doing therapy first and trying to always put surgery as a last option, because we want to try to get you back to, your everyday life without having to cut into you if we can. So, the other thing you can do besides PT is really working on mindful breathing. So with the exercises, it's very important that you breathe with the exercises and you breathe through the pain, because that can help you control the pain and how you deal with pain much easier. And we go through this in therapy all the time, where we remind you to breathe, or we teach you how to breathe with your exercises so that it's more tolerable to get through until you get used to it, and then you don't have to work so hard to think about it anymore. So the big benefits of breathing, most of us don't actually know how to breathe properly. We chest breathe, so we're only using, from our rib cage up to breathe a lot of times, because we're too worried about, how our abdomen looks or how our figure looks, and we want to keep that nice figure all the time. Well, when you're in pain, it's more important to take good, solid breaths than to always work on worrying about what we look like. So the picture shows the cycle of breathing, where when we inhale, our diaphragm kind of balloons out and down and makes our abdominals kind of push out. And then when we exhale, it pulls our abdominals back in, and then that balloon kind of pushes back up and out. And that's what you really want to see, is that your abs are moving at the same time as your lungs. So when you're breathing in, you actually are feeling your abs move first before you feel your lungs. That's how you know if you're getting a good mindful breath or not. So one of the best ways to learn how to do mindful breathing is, the picture of the diagram of the girl on the left. You put a hand on your abdomen, you put a hand on your chest, and you just focus on your breathing. It doesn't have to be fancy, and it's just focusing on how are you breathing. Are you noticing only your chest is moving, or are you noticing only your abdominals are moving? The idea is to try to get both moving together. Then the more you just focus on that breathing, you'll notice after a couple minutes and you rest and just do things normal, that things feel more comfortable, and sometimes your pain actually goes down fairly quickly. So for those who can't handle sitting up, unsupported, you can also do this laying down. Same thing, get your neck and back supported, your legs supported, hands on your chest and abs, and just breathe in and out, focusing on seeing if you're getting both the abdominals and your chest moving together, out and in. So exercises. The last part of this presentation is basically going through the main exercises we give people in general for neck and back pain. So the first one is the cervical shrugs and into extension. So it's just take a towel, something comfortable, you put it around your neck, kind of pull down a little bit, and you just slowly lift your head up and back down. You don't want to go fast, but what this does is helps to stretch out the tight muscles in the front of the neck, while also kind of massaging the muscles in the back of the neck, which helps to kind of relieve some of that pressure. The next one are called snags with a rotation, and you do what we call a crisscross. So instead of your towels just here, you take one hand here, you cross here, and then you pull this way. You hold for a little bit, and then you bring it back. You'll do that a couple times, then you switch to the same. Or if you know one side hurts more, you only focus on the one side, and that's it. The next one is working on the chin tuck. So if you're having a bad headache or your neck's really stiff, just kind of laying flat with a pillow underneath your head and pulling your chin back, not enough to make it hurt, just enough to feel that pressure. Do that a couple times, and that can help kind of just get the cervical vertebrae moving a little bit easier. For low back, one of the most gentle ways to help get the back moving a little bit more is against the wall. So on your forearms, you sit back just enough that you can lean in, but it's comfortable, and then you're just arching your back till your tummy hits the wall. You do that a couple sets, and they'll start to take some of that pressure in your back down. If you're having some sciatic pain down the legs, it helps to kind of narrow and intensify more into the low back, which is a good thing. That means that things are starting to move and shrink back to kind of how it should be. Peck stretch. For a lot of us that have poor posture, we round our shoulders and we get stuck like this. So that doorway stretch can help stretch out those pecs, opening up to kind of open this up a little bit more and take that pressure off your low back, or not just your low back, but also your shoulders, between the shoulder blades. Corner stretch is a little bit gentler version of the same exercise. So if you don't have a doorway or it's too much, find an open corner and just kind of lean in a bit. You'll get the same type of stretch. So if the wall exercise is not comfortable for you, or you don't feel balanced enough for that, you can also do a similar stretch sitting on a chair with a back. And you're just leaning back into it. You know, if you need to, you can put like a towel or something, you know, on the back part and move it up or down just to give you a little bit more of a stretch when you're leaning back. Bird dog. This one is great to help start building that stability in your core and in your back. And it's not easy at first, but it's one of the fastest ways to build that abdominal and back control for any kind of back pain or hip pain you're dealing with. The Supine March is a gentler version to start engaging the lower core to help with that back pain and help to strengthen your lower abs. Most people who deal with back pain in their low back, if it's not a trauma, is because they have very weak lower abdominals. So these help to start building that stability back up to take the pain out of your hips and low back. For those who struggle lifting their legs, you know, the abdominal bracing is another way to do the same thing. You're putting your hands on your low abs and you're basically pulling your belly button towards your spine, trying to flatten that low back against the mat as hard as you can and still breathe. And then you relax. And even though it looks very easy, if you have any weakness, this is not an easy exercise to do, but it's also quite rewarding when you start getting good at it if you stay consistent to really start seeing changes quickly. For getting a decent stretch without worrying about injury, we also don't just call this a sideline thoracic lumbar rotation, we call it an open book. So you start with your hands together on your side, and then you open them up just like a book. You hold for a little bit, and then you bring it back. A lot of people find that with this stretch, it also works the pecs a little bit, and it helps to really loosen things up. Dead bug is very similar to downward dog. It's just reverse. You're on your back. And there's multiple levels of dead bug, but I put the very basic one on here to give you an idea. Again, it's going to work your total core, but it's also helping build that stability for your back. And with a pillow, most people use a pillow for their neck just for a little bit more support in the head if you can't get your head all the way back on the floor. For stretching, stretching is just as important as your exercises. So especially for low back pain, bringing your knee to chest or as close as you can get it, holding it for a little bit, and switching legs gives your low back a chance to kind of stretch out, gives the vertebrae a chance to kind of stretch out and not feel like they're compacting hard on each other. It kind of opens things up a little bit more, and it tends to be quite relieving for a lot of people who suffer from back and hip pain. You know, if you have a strap at home or a belt or a dog leash, the hamstring stretch with the strap is probably the easiest way to start learning how to stretch the hamstrings without making it feel like you're trying to rip your leg off. It's much easier to do and it's a lot more comfortable. You just want to make sure that you only go to where you can keep your knee straight. Once you start to bend that knee, then you lose the stretch. The same thing applies when you're sitting. If laying down's too hard, you just want to make sure that it's only stretching to the point where you're not bending your knee, otherwise you're not getting a solid enough stretch. Now, this one I only recommend for those who don't have any issues, but it's a really great stretch for your hip flexors, which is on the front part of your hips, to really stretch out the front of the leg, which can also contribute to back pain if you're not keeping the front of your hips loose enough, because if they get too tight, you're going to start pulling forward too much. So that is all of my exercises. I hope that the information was helpful. If you have any other questions, you could always just email us. We will have this webinar on the website as well. And I'm ready to take any questions if anyone has any. Okay, well, thank you for joining me. I hope this was informative, and I hope you all have a wonderful day.